Hey, and welcome to Advanced Test Taking Strategies. I am excited because this is one of my favorite topics to talk about. And I must admit that this is one of the most important topics because so many individuals have such a hard time with test taking strategies. And it's one of the things that I really focus on a lot. So, as we deep dive into this topic, let me just share with you that this is something that we're going to work a lot on as you go throughout this course. I think that content is one thing, but if you don't have the right test taking strategies and tools, it can definitely be horrible for you and your test taking skills. So I want you to pay very close attention to the information that I'm be sharing with you because a lot of this is information that you will not find in your textbooks. You will not find other places. It will be information that I'll be definitely giving to you, hopefully one-on-one. But a lot of this information, we may not even have time to go over one-on-one together, hence why you have it inside of this hub. So we're going to dive in, but go ahead, grab your notebook so you can definitely take notes. I'm going to go through this content pretty quickly because I don't want this to be too long, but I'm definitely going to be very, very thorough in my approach. All right. So with that being said, if you have questions as I'm going through, please make sure that you write them down. I also encourage that you write your questions down because you can have your questions readily available for discussions during our one-on-one sessions, but also for discussions during question and answer sessions, as well as you can comment and leave your questions inside of the portal. So one of the things that I think a lot of people do is they tend to really read into questions. Now, here's the thing, okay? One of the things that I will tell you, you got to keep it black and white, okay? When you're answering questions, you want to keep it black and white. You want to keep it black and white, and you do not want to change the scenario, okay? You don't want to add what you think based upon your experience. You don't want to, create all this additional narrative. Whatever is in the stem of the question and the scenario, that is it. Point blank, period, the end. Leave it alone, let it go, all right? Avoid asking yourself the forbidden words of, well, what if this? Or what if that? No. Only focus on the scenario. So what are we going to do? We're only going to do what? Focus on the scenario. You got it. All right. Because guess what? This will lead you to the forbidden area of reading into the questions. So I want you to focus on the data in the question, read every single word, and make your decision about what the question is asking. You're going to reread the question, focusing on your 1 through 5 that we always talk about, and asking yourself the question, what is the question asking me, right? That's the second point in our 1 through 5, correct? All right. So you want to ask yourself, what is this question asking me? And you want to look for the key words. Again, that is the priority. You want to say, what's the priority keywords are what? Initial, best, follow-up, need for further teaching, the strategic words. These are the words that really is going to make a difference regarding what the question is asking you. And then in the multiple choice questions and the multiple response questions, these are going to be the questions that require you to arrange the nursing interventions or other data in order of priority. So you're going to read every choice or option presented before answering. You're always going to use the nursing process of elimination when looking at choices or when options are presented, regardless of what, okay? It doesn't matter what question you're answering or how you're answering, you're always going to use the process of elimination when looking at the choices or the options and how they are presented, right? And that is going to be very important. You're going to focus on the data in both the questions and the options to assist you in the process of elimination. and how you're looking at that answers. Now, here's the thing. When you're looking at questions that require you to fill in the blank, I want you to focus on the data in the question. You got me? Focus on the data in the question and determine what the question is asking. If the question requires you to calculate a medication dose, or for example, if it's asking you to look at an IV flow rate or use a I&O output amount, recheck your work in calculating it. You always use the on-screen calculator to verify that information, okay? That is going to be very, very important. So going back to those strategic words, I want you to focus your attention on the critical points to consider when answering the question, and I want you to eliminate the incorrect options that you know are wrong. All right? So you can look at the different words, the keywords that we've talked about, and use that to help you eliminate the answer choices within the choices that you have within that question. Very important. Okay. Now, the other thing is, I want you to look at, not only as you're focusing on the strategic words, but I also want you to focus on the answers just as much as you're focusing on the stem of that question. I think we spend a lot of time focusing on the stem of the question, which is very important, but you got to spend just as much time focusing on those 4 answer choices, okay? So let's go over, before we dive into that, let's go over just some of those key words that is just very important. So when going over some of those key words, here's what I want you to think about. Here's some of the common strategic words, and you can write these down, okay? Best, early or late, essential, first, highest priority, immediate, initial, most appropriate, most important, most likely, next, primary, vital, okay? Now, when you're looking at words that's more so like asking you for the assessment of something. So if I'm talking about asking you for your nursing assessment, these are the words that you're going to look out for. Ascertain. That's ASCERTAIN, ascertain. Okay, that is, you're trying to ascertain something. I'm trying to look for something. I'm trying to assess something. I want to ascertain the assessment of your blood pressure. Okay, assess, check, collect. I want to collect your urine output. I want to collect your vital signs. Okay, determine, find out, gather, identify, monitor, observe, obtain information. You guys have heard all of these. Recognize. Those are all assessments, okay? Now, when you're looking at practice questions, the subject of the question is just as important, okay? The subject is just as important. So I want you to, here's a advanced strategy. I want you to focus on the subject, okay? And note the strategic word, for example, most, okay? So here's an example. If you have a question that says, the nurse is teaching a client in a skeletal leg traction about the measures to increase bed mobility, which item would be most helpful for the client? And let's say you had television, fractured bedpan, overhead trapeze, or reading materials. Okay, so a test taking strategy would be to focus on the subject, which would be increasing the bed mobility, right? So looking at the strategic word most in that statement, you would use the overhead trapeze, which would be extremely helpful in assisting a client to move about in the bed and to get out of the bedpan, right? So focusing on the subject is very, very important, okay? Very important. Now, when you are looking at prioritization. I want you to think about it this way. Very important. Many of the questions on the exam will require you to use the skill of prioritization of nursing actions. I want you to look for strategic words in the question that indicate the need for prioritization. So remember that when a question requires prioritization, a lot of the options may seem correct to you, but it is your job as a nurse, all right? It is your job as a nurse, guys, to make sure that you know the order of prioritization. You're going to do this based upon ABCs, which is what? You know it. What is ABCs? All right, very good. Maslow's hierarchy of needs. What's Maslow's hierarchy of needs? You know what it is. What is it? Come on, let me hear you say it. Good. Good. What's at the base of Maslow's hierarchy of needs? I know you know what it is. Very good. All right. So Maslow's hierarchy of needs, theory, and the steps of the nursing process. So here's how we're going to do it. Use the ABCs. What's ABCs again? You got it. Airway, breathing, and circulation. You're going to use that when selecting an answer or determining the order of priority. Now, remember, the order of priority, ABCs, remember that, okay? Airway is always the first priority. Now, the exception to this occurs if you have cardiopulmonary resuscitation that's being performed. In this situation, the nurse is going to follow CAB, compressions, okay? Airway, breathing guidelines. Now, I want you to go back to your book and I want you to look at Maslow's hierarchy of needs if you just need to kind of spruce up on that. It's okay if you do. But according to Maslow's, physiological needs are the primary. What's after physiological needs? Safety, good. What's after safety? Security, very good. What's after security? Love, very good. What's after love? Belonging, very good. What's after belonging? Self-esteem, very good. And finally, what's the last one? Self-actualization, very good. So you want to make sure that you're addressing all of those needs when you're doing that, okay? All of that is going to be very, very important, okay? Now, just as important is our infamous process of the nursing process. I know a lot of us were like, oh, I know the nursing process, but do you know the nursing process, okay? Because the nursing process is so basic that sometimes it's like, do I really know it, right? Let me take a drink. And the reason why I say that, something's the simplest things can be the hardest things on this exam, right? So the nursing process is assessment, okay, at the core. But you want to use the steps of the nursing process for prioritization. So wait, what are we using the nursing process for? You got it, prioritization. The steps include assessment, analysis, planning, implementation, and evaluation. You can remember this by the acronym AAPI. Let's try that again. AAPI. A is for analysis. Excuse me. A is for assessment. A is for analysis. PI. P is for planning, right? I is for implementation. E is for evaluation. Let's try it again. AAPI. A, assessment. A, analysis. PI, P, planning. I, implementation. E, evaluation. Very good. If you need to pause this and do that a couple more times and rewind it and listen to my voice again, please do that right now. Assessment. Assessment, really, the questions address the process of gathering subjective and objective data. Now, this data is really relative to that client. You want to confirm that data, you want to communicate, and you want to document. Because remember, your assessment is your baseline data. What's your assessment? Correct, your baseline data. So you're going to gather that data. You want to make sure that it's relative to the client. You're confirming that data, and it's communicating and it's documenting that data. Now, your assessment is the very first step in the nursing process. When you're asked to select first, immediate, initial nursing action, follow the steps of the nursing process to prioritize when setting that correct option. What are you looking for in words that reflect assessment? You're going to make sure that you are looking for those specific options, okay? So familiarize yourself with that. Familiarize yourself with the nursing process. Go back in your book and read it. Very, very important. Very important, okay? I want you to also go and practice some of the questions that is focused on your nursing process. Very important, right? The next thing is your client needs. You always want to make sure that you have a safe and effective environment for your client. I love how this is broken down into safe and effective care environment, physiological integrity, psychosocial integrity, health promotion, and maintenance. Make sure you're familiar with all of those, okay? Now, just as important is to make sure that you eliminate comparable or alike options. So this is how you do this. You want to read the options in multiple choice or multiple response questions, and you want to look for options that are comparable or alike. Comparable or alike options can be eliminated as possible answers because it is not likely for both options to be correct. So I'm going to say that again. This is important. Listen to what I'm saying. When you're reading the options for multiple choice or multiple response questions, what are your multiple response questions? Those are your select all that applies. Look for options that are comparable or alike. So you want to look for options that are alike. When you have comparable or alike options, you want to make sure that they can be eliminated as possible answers. Any answers that you have that are alike, you can eliminate them as possible answers because it's not likely for both of them to be correct. So find the answers that look like they're alike and get rid of them. That's what that's saying, okay? Very important. You cannot have two answers that's alike and that's the right answer on that exam. Make sense? All right. All right. We are cooking with hot grease. All right. So here's the other thing you want to do. Eliminate options containing closed-ended words. Now, do you know what closed-ended words are? What is that? Give me some examples. Let's see if you know. What are some examples of closed-ended words? Tell me. You are so brilliant. See, you know this stuff. You don't even need, like, why am I even here? You don't even need me. You know this stuff. Closed-ended words are all, always, every, must, none, never, only. Let's say that again. Closed-ended words, all, always, every, must, none, never, and only. Write those down, all right? You want to eliminate options that contain closed-ended words. So what are we going to do? We're going to exit out any options that have those in there because these words simply imply a fixed or extreme meaning. These types of options are usually incorrect. So if you see an option that has those words in there, we want them out. That's not what we're going to choose. So what are those? Those are options that have all, always, every, must, none, never, and only. When you see an answer choice that has those words in it, we're going to run away from that answer choice. We're going to go towards another answer, okay? Now, options that contain open-ended words. What are open-ended words? Listen, you got this. You got this. Yes. Open-ended words are may, usually, normally, commonly, generally. Now, these are the good words. This is what we want, okay? This is gonna pull us towards the right answers, okay? These are the good stuff, okay? So what are they? Say it with me. You got it. Let's do it. Ready? Don't go before me. Wait on me, girl. Wait, just wait on me, all right? So here's the right words. Open-ended words. Let's go. Usually, normally, commonly, generally. I feel like that could be a rap. Let's make that into a song, all right? Usually, normally, commonly, generally. Those are open-ended words, all right? Those are the ones that we want. Those are the words that we want to choose, okay? Now, the last thing that I want to share with you guys, or maybe not, close to the last, don't worry, we're going to wrap up soon. Those are umbrella options. Now, I talk about umbrella options a lot because these are my favorite things, because I feel like they're like the holy grail, easy to spot. And these are like the easiest things to choose for the right answers, okay? And we like the right answers because that's how we get a win-win on our exam, and that's what we want. So what is an umbrella option? Hopefully we went over this before. An umbrella option, guys, is one of my favorites, like I said, but this is basically a broad answer that encompasses the other three answers. So it is broad enough to encompass the other answers, okay? So anytime you see that, you're going to choose that term, okay? Now, let's talk about delegating assignments. When I tell you, probably two things. Delegating assignments is the number one thing that people have issues with, and pharmacology questions. And I'm about to break down both, all right? So hang in there with me. We're going to wrap up with these, but I'm going to make it super simple just for you. You ready? Let's do it. You got this. Let's go. So delegating assignments. This is how we're going to do it. Now, the reality is you may be asked questions on this exam that require you to delegate or assign tasks to clients, right? I want you to focus on the information in the question, and I want you to really focus on what task or assignment that is going to be delegated. Focus on the information in the question. Write that down. And what task or assignment is to be delegated. That's all you need to focus on. Once you know the information in the question and the task that's being assigned to be delegated, then I want you to ask yourself, so when you've done that, when you have determined what task or assignment is to be delegated, consider the client needs and match the client's needs with the scope of practice of the healthcare professional that is identified in the question. Simple. The Nurse Practice Act and any practice limitations will define the aspects of care that can be delegated and which must be performed by a nurse. It doesn't matter if it is a LPN or if it is a RN. Remember, the NCLEX is a national exam and it has national standards. It is not agency specific. We're not answering this like an agency nurse. We're answering this like a national exam. I'm going to say that one more time. The NCLEX is a national exam. We're not answering this as an agency specific exam. So, in general, non-invasive interventions such as skincare, range of motion exercises, ambulation, grooming, hygiene can all be assigned to unlicensed assistance personnel. An LPN can perform tasks that unlicensed assistive personnel can perform and can usually perform certain invasive tasks such as dressings, suctioning, urinary catheterizations, medications orally, sub-Q, IM, and some piggyback IV medications can also be administered. An RN can perform the tasks that an LPN can perform and is also responsible for assessment, planning of care, analyzing client data, implementing evaluation of care, supervising care, initiating, teaching, and administering medications IV. You understand? So know that. If you got to rewind that and play it again, go ahead and do it. Take your notes, read it, and brain dump it. But know it, okay? Very important. That is all throughout your test, okay? Now, we're going to end with this. Pharmacology questions. The easiest way that I can tell you this is that if you are familiar with the medications, use your nursing knowledge to answer the questions. Remember, the questions will identify, write this down, generic names of medications on most occasions. If the questions identifies a medical diagnosis, I want you to try to form a relationship between the medications and the diagnosis. For example, you can determine that certain medications, if the question refers to a client with breast cancer that's taking the medication, you can determine that that medication is for breast cancer. Try to determine the classification of the medication being addressed to assist in answering the question. Identify the classification. It will help you to determine the medication or the side effects or both. Recognizing side effects and adverse effects associated with each med classification and relating that nursing intervention to each effect. For example, if a side effect is hypertension, the associated nursing intervention would be to monitor the blood pressure. Focus on what the question is asking or the subject of the question. For example, intended effect, side effect, adverse effect, or toxic effect. You want to learn medications that belong to a classification, okay? So beta blockers, learn them by, they all end in LOLs, LOL, like atenolol. If the question is requiring a med calculation, remember, a calculator is available on the computer. Talk yourself through the steps. Make sure that that answer makes sense. Recheck your calculation before answering it, okay? For pharmacology, here's some points to remember. In general, your client should not take an antacid with medications because the antacid will affect the absorption of the medication. Insert-coated or sustained release tablets should not be crushed. Also, capsules should not be opened. The client should never adjust or change a medication dose or abruptly stop a medication. The nurse never adjusts or changes the client medication dosage, and it never discontinues the medication. The client needs to avoid taking any over-the-counter medication, any other medications such as herbal PrEP, unless they are approved for use by their healthcare professional. The client should avoid consuming alcohol. Rule of thumb. Medications are never administered if the prescription is difficult to read, if it's unclear, if it identifies a medication dose that is not a normal one. And then additional strategies for answering any pharmacology questions. I want you to go to your Saunders book, and I want you to look at the questions that are presented in the Saunders strategies for test success, passing nursing school, and the NCLEX exam. They have some great information within that area. Okay? So that brings us to the conclusion of this section. If you guys have any questions, please make sure, again, you reach out to me. I hope that you enjoyed it, and I look forward to speaking with you guys on the next class session. I'll talk to you guys soon.